Hello, this is Dr. Dondre Simpson. I'm a general dentist and I have dental advice for you. The topic of this video will be functions of the teeth. So obviously, hopefully you've seen other videos on my channel. If you haven't, please subscribe and take a look at them as we've gone over the anatomy of the tooth, how a cavity looks like, the different levels of a cavity. But let's actually look at the types of teeth. The general notion is that obviously the mouth has teeth. Obviously there's front teeth, there's side teeth, there are back teeth. Okay, so let's look at the diagram here and see the different shapes and functions of them. All right, so if you notice, there's 4 types of teeth or classifications of teeth. Okay, the front teeth right here are called the incisors. All right. And incisors, incise means to cut. All right. So you like scissors cut. These teeth cut into your food, but they also function as primarily your major smiling teeth. As I've noticed in my many years of being in dentistry, people are very concerned about these teeth. I've even had some people say, "Doc, can you fix my frontals?" Okay, I'm kind of had to think about that, but if you think about it, hey, frontals, you want to get them front teeth because you want to smile, look pretty, look handsome, look presentable. So those incisors, again, they act like scissors. They cut, they grasp and cut into your food. But again, they're also your main smiling teeth. So you can add that to that description too. The next type of tooth, we're going to go down here, is your cuspid or your fang teeth, like, shark or Dracula have those big fangs. Okay, those are called cuspid or canine. Canine teeth. Obviously, canine usually stands for dog, where dogs have those prominent canine teeth that also shreds and tears into food more because they're more sharper and more pointed. Okay, as you can see this point right here. So those, we have 4 of them. We have one on the upper left, upper right, lower left, lower right. Okay, left, right. And very important, and they're probably have the longest roots of all of the types of teeth also, because they're strong. And they have to be strong because they rip and tear or help rip and tear the food that we eat. As humans, we pretty much don't eat a lot of tough food like lions and dogs and wolves and stuff like that do. Was it wolves or wolves? But as I digress, totally understanding that the cuspids are very, very important, okay, for not only the tearing and the strength of them, but obviously they're in your smile line too. So they help form the corner of your smile before the teeth start transitioning to the other 2 types of teeth that go back towards the back of your mouth. So they're very important in your smile also, okay, just like the incisors are. The third type of tooth is called a bicuspid. We also call those premolars. So if your dentist says bicuspid or premolar, you know that those are the teeth right behind the cuspids on the top and bottom, and you should have in a ideal mouth 8 of those, 2, 4, 6, 8. All right, and you have what they call a first premolar or bicuspid, and then a second premolar is the ones behind the first premolars, and those usually have 2 points on them, and they do a little assisting when it comes to shredding and tearing into food, but then they start to transition as they are considered back teeth, even though they're the front of the back teeth or the teeth that are more towards the front. They start crushing because they have, as we cannot see here, but they have a table or like a table where the 2 points are, and those not only tear into food, but they also start to help crush the food and transition that food back towards the last type of tooth, which is called the molar. And the molar obviously are your big teeth in the back. And we usually have, in an ideal situation, first, second, and third molar. And we usually have 12 of those, 3 on the upper right, 3 on the upper left, 3 on the lower left, 3 on the lower right. And they are categorized as first, second, and third molars. The third molars, if you really don't know what they are, you probably heard of wisdom teeth. Those are third molars, which is the last teeth in your mouth, whether you're using them or they've been pulled or extracted out. And those are by far the strongest teeth because they do crush. I know I said the canines are strong. They're very strong when it comes to the tearing, but when it comes to just the strongest, because the characteristics about the molars is they usually have 2 or more roots. Sometimes the premolars or the bicuspids will have maybe 2 roots, but mostly they have 1 root. But the lower molars have usually 2 roots, and the upper molars have 3 roots. So those primary functions for those molars are to grind your food, so that way after you swallow your food, your stomach does not have to break down the food as much as it normally would. That's where you can hopefully save yourself from having what they call indigestion and things like that, because the more you grind your food and chew it to almost like a paste, if you can, then that's less work that the stomach has to do during digestion. But again, we're getting outside the mouth, but again, the mouth is connected to the rest of the body, so we can't neglect that. But again, I appreciate you looking at my videos, and if you have any questions, any concerns, please feel free to comment below, and I'll do my best to get back to you or my staff. And again, this is dental advice for you. Thank you.